With the demand for mental health services growing across the country, Cygnet has embarked on an ambitious expansion programme to help alleviate pressures on A&E departments and local NHS services. Today, Cygnet offers a network of more than 750 urgent admission beds nationwide for adults needing rapid access to mental health care, including psychiatric intensive care and acute wards. In the last 5 years, Cygnet have supported over 18,000 individuals in our PICU and acute wards, with 99.8% of people successfully discharged back into the community or stepping down to other specialist inpatient provision.
PICU and acute services are invaluable for people who are having a crisis because you're bringing them into an environment where the risks are mitigated. We can help them kind of piece together what's not working well before they go back home and all the stresses continue. You know, we like to try and ease some of the stress that they're under and mitigate the risks.
Our range of urgent admission services take referrals from a variety of pathways, including A&E departments, community mental health provision, inpatient care, and those who are unwell in the criminal justice system. At Cygnet, we provide a central referral handling service. The Cygnet Bed Hub operates 24/7, coordinating and overseeing referrals to ensure each person receives the right care at the right time.
Having a central bed hub and referrals management team ensures that the patients get the respect that they need and the treatment that they need as soon as possible, without having to deviate from anyone else's job roles and having to take away from nursing time within our hospitals.
Our corporate response time for referrals is under 1 hour, but we strive to be as responsive as possible. Most referrals are responded to in under 30 minutes.
With coverage across the UK, we're trying to make sure that people are treated as close to home as possible. If a bed isn't available in the nearest hospital to where the patient lives, our referrals team will coordinate the patient to be placed in the next best hospital, and our bed management team will work really hard to repatriate that patient back to their closest home hospital, if appropriate within their treatment pathway.
At Cygnet, all of our PICU and acute wards have 24-hour medical cover and take admissions 24 hours a day. Each ward has an experienced multidisciplinary team comprising of registered mental health nurses, physical health nurses, psychiatrists, psychologists, occupational therapists, and social workers. The team aim to stabilise the individual as quickly as possible, and our average length of stay on our acute wards is 38 days, and PICU's 35 days.
We focus on the length of stay. Individuals in our care are moving on as quickly and as safely as possible into the environment that's most suitable for them and is as least restrictive as possible for them.
Delivering good quality services is a key priority for Cygnet, and we have developed a robust model of care which is consistent across all services.
The model of care that we have in the PICU and acute service, this was made collaboratively. This is to ensure that we're working together to make a positive change in the lives of the people that we support.
We work in partnership with NHS trusts to provide block contracted beds as additional NHS capacity. All block contracts are allocated a named bed manager who delivers daily updates on patient flow and liaises with our wards to navigate potential barriers to discharge. This helps to build closer working relationships between teams, leading to better continuity of care, reduced lengths of stay, and improved outcomes for individuals.
In my role as social worker, I focus a lot on the discharges and looking at what support people need and trying to make sure that the community teams are aware of the patient and kind of advocating for them in terms of what support they'll need when they leave hospital. As soon as somebody comes through the door, my thought process is, where are they going to go? What is that going to look like? Do they need extra support? What does their family think? What does the person think?
What they did at White compared to previous placements that I'd had was they created an environment and an atmosphere on the ward that made me feel safe and comfortable to express my feelings and share my thoughts. It was a turning point. It opened my eyes to what was possible for my future.
At Cygnet, we are committed to providing high-quality, urgent mental health support where it is needed most. We believe that everyone deserves the opportunity to recover, rebuild, and move forward.